One of the greatest fears that patients and their loved ones face as the end of life approaches is that they may suffer with no control over pain and other symptoms. In my experience, with good end-of-life care planning, this is rarely the case. Common symptoms experienced by people with advanced illnesses include pain, breathlessness, nausea and vomiting, constipation, a loss of appetite, and extreme tiredness and fatigue. For people who've been living with pain, breathing difficulty or sickness which has been controlled by regular medications, it is simply a case of transferring the doses to be delivered by injection rather than by mouth. A small battery-powered device called a syringe pump can be set up for people at home, in hospital or in a hospice, which will deliver the pain relief and symptom control that they need. Understandably, some people can become anxious or worried as their health changes, while others may be a little muddled or unsettled. This is very normal and often responds to calm reassurance. Sometimes, alongside this care, the person may need additional medications to help manage confusion or anxiety. The aim of these medications is to control the symptoms and help the person to settle, rather than sedation, although sometimes people appreciate an element of drowsiness to help them relax. Occasionally, people can develop noisy breathing as they near the end of their life. It's often a very normal part of their weakening state. Loved ones may worry that it's distressing the person, but it actually reflects the fact that they are relaxed and comfortable. A simple change in position may be enough to clear the noise, but if it remains troublesome, drying drugs can be given by injection to reduce any extra fluid that might be contributing. A peaceful death with minimal suffering and distress is something everyone wants for themselves and their loved ones. With some honest conversations and a little planning, this is exactly what we can achieve. In their final hours, a person might be increasingly tired, lose their appetite, spend more time in bed, sleep more, become confused, or become less mobile. A blood test or a scan might confirm, sadly, that an illness is getting worse, or the person themselves or someone close to them may sense that something in them is changing. Some people want to die at home, others in a hospice, and some may prefer a hospital where their long-term treatment has been provided. There's no right or wrong way to do it. No one can say exactly what will happen and when someone will die. This is because everyone is different. There's not one pattern that people follow. You can ask the doctor or nurse about how long your loved one might live for. They will not be able to give you an exact answer, but may be able to give you an idea, given the overall progression and the evolving symptoms. It's important to understand that this is only an estimate, and they will not be able to know for certain when and what will happen. Finally, I just want to say that you're not alone at this difficult time. The doctors, nurses and healthcare team will be with you and your loved ones throughout, helping in any way required to minimise any suffering and distress.